The Nigerian Medical Association is seeking to create a minimum benchmark for remuneration of doctors in the country. President of the association, Professor Bala Haudu, said this on Saturday while briefing newsmen on the communique issued at the end of the third National Health Summit and National Executive Council meeting of the association in Abuja. He said NEC observed with concern the disparity in remuneration of doctors in Nigeria, especially those working in state governments, private institutions, and some ministries, departments, and agencies. According to him, creating a minimum benchmark of remuneration for doctors will help tackle mass migration of doctors outside the country, popularly called JAPA. He said the strategy will help Nigeria retain its critical healthcare workforce and prevent the ongoing JAPA syndrome. He said, quote, what it seeks to do is to ensure that every registered doctor who is licensed by the Medical and Dental Council of Nigeria has a minimum remuneration benchmark that you cannot go below, whether the individual is employed in the public sector or in the private sector, end quote. Now, let's quickly have this conversation with the Director General, Nigeria Center for Disease Control and Prevention, Dr. Jide Idris. Thank you for joining us on the News Night.
My pleasure.
Well, 4 years down the line, we are back, talking about a new variant, COVID-19 called XEC. Let's start with some good news. I know the federal government or Federal Minister of Health has confirmed that there is no such case, or there's an absence of the variant in Nigeria. But how reassuring is this for Nigerians, especially with this festive season approaching?
Well, basically, that's why we need to get the information to the people. COVID, has been on for a long time. It's the family of the same flu influenza virus. So over the years, it's going mutation, become more and more virulent, ended up with COVID. Now, since the last outbreak of COVID, let me say for a fact, we've seen a reduction in the number of COVID cases, but the fact that we still have COVID. But the COVID we have is less virulent, it's very milder, and causes less problems, and that's why people are not making so much noise about it. Now, this one that came in now, started like the COVID again undergoes mutation ever so often. So we have many variants of that virus. There are some they call variant, well, two of them that are very common. They call them variants of interest. That is, the variants, they're still studying them, of interest to them because there's a possibility that they may become more virulent. Now, those ones are not here. The XEC is classified under variant of period under investigation, under monitoring. It's not as serious as those on variant of interest. But again, the other is that we are monitoring them. I must say that, okay, so we don't have that in this country right now.
All right. It's so reassuring to hear that, we don't have that in the country right now.
However, it is essential that because we don't have in this country right now, doesn't mean that it cannot come.
Just to put the button a bit, I mean, we are aware that, the public should be calm. That's what the federal government is saying. Like, look, the public, we need you to remain calm.
Definitely.
And that's very reassuring. We understand that. They are also saying that we need to rely on verified information from official sources. But the information out there is that this variant has spread across 29 other countries.
More than that now.
We don't have any reported case in Nigeria at the moment. But what do you think this means for Nigeria in terms of potential risk, even though we currently have no reported cases? And secondly, can you clarify why the federal government, Federal Minister of Health is so confident that this has not entered Nigeria?
Ever since COVID, we had happened on COVID. And mind you, it's not only COVID we have in this country. We're monitoring several outbreaks of diseases. Lassa fever, meningitis, including COVID. So, and it's essential for any country to be in a position that whatever emergencies you come across, you're prepared for it and you're ready to respond just in case you see those cases. And so over the years again, the Center for Disease Control, the Ministry of Health, all the other state governments again, have been beating up, be preparing for things like this. You understand me? So it's so similar. You look at, you enlighten the public what these diseases are, depending on the kind of disease, disease you're at play. You monitor or you track events of these data, occurrences, cases you have in different parts of the country using different methods. And then once you monitor again, you try to detect. Say, for instance, now the COVID. You can detect COVID or a virus. You want to detect now which, you want to now characterize which strain, which variant, you know, and we have those capabilities ready. The same we did for Mpox. You have clade 1, clade 2. Luckily, we have clade 2 here. Clade 1 is the most serious one. So we need to prepare again that clade 1 does not come in here. Even when it comes in, we can detect it easily. So we say that preparedness is done for every other disease of interest in this country, or every other disease of public health interest. So we go through awareness creation, detection, so we call surveillance, different methods of surveillance. You can use data, you track data, occurrences from institutions, from states, from different aspects, social media, etc. And if you are not sure again, you have to detect what is happening. We now use laboratory services. If you recollect again, during COVID, we built up a lot of laboratory services. Because COVID is characterized under virus, a variant of serious concern.
Right.
High consequence, because it kills.
So I want us to run through some of the, conversation or key point I have here, because quite a lot of them. I know COVID-19 has taught us, or taught the world, many lessons. But how can Nigeria, leverage past experience to enhance the way they respond, to the public, and of course its communication strategies? Don't forget, during COVID-19, we had similar experience where communication, was not properly pass across to the citizens. And that's because we hear, a particular numbers today, and of course tomorrow we are getting, and so sometimes we don't even know what to believe. So have we learned any lesson from COVID-19? And if yes, so how can we leverage these past experiences?
We've learned several lessons. The basic lesson to cover it all is that a country must be to build capacity for public health infrastructure to be able to attack any disease outbreak. You understand me? And it covers awareness creation, which is key. And awareness creation is not as easy as most people think. And that's why again, NCDC and that you use media consultants, people who understand communications, who can draft messages, who can help us pass on these messages. And again, the message you pass on at the national level may not necessarily be the same thing or the same way at the sub-national level, because now each state now has its own different determinant characteristics, cultural differences, traditional differences, and those messages must be culturally or traditionally sensitive in terms of language again. So you need to, so that is there. And that's why when we pass on the message at the national level, we send them to the states. The states now domesticate them using the community people, using media people, using all the necessary resources we have to disseminate it. And again, you can't do this effectively without involving the committee members. So community involvement is key when it comes to awareness. The second one is that in detecting or in following up that surveillance, we're now adopting higher methods of detecting. That, like look at environmental surveillance, genomic surveillance, which is even key now. Because it's not surveillance now, it can now detect the changes, DNA changes that make these viruses change form, whether they become more virulent or they become more transmissible. You understand? So if we develop those sciences in our laboratory, now develop those capabilities in those labs, and that's what we are doing here now. All over the country, we have labs that are set up for COVID testing. Those labs, again, have been modified, upgraded to be able to test not only for COVID, for other similar things like Lassa fever, monkeypox. You understand me? And again, when you start testing that, you know what is that. Along the line, again, you start preparing for any emergencies.
Right. Let me also come in. I know your agency is directly, has direct oversight functions in terms of controlling information and communication strategies and all of that. I understand you just told me that you're fully prepared. Specifically, tell us what you have on ground in terms of the quality or the capacity of the equipment, the laboratories you have across how many hospitals do you have? Those facilities, and in terms of also you managing, this variant in case of eventual outbreak. Explain to us what these facilities can do and the capacity of these facilities.
Let me say, when we say infrastructure facilities, you have medical facilities for clinical services, where doctors, where patients go to. Now, we have facilities for detection. These are laboratories, and there are different grades and different levels.
Right.
You have laboratories in teaching hospitals, in general hospitals, but they have different capabilities for scope of services. But the idea is that when the patient goes there, you can have a fair idea of what the patient has. Based on the symptoms the patient addresses, you have guidelines, clinical guidelines, we're given out to all the states. Look at the clinical guidelines. If they conform with certain trends in the clinical guidelines, there's a high level of suspicion. So if the hospital doesn't have the capability to detect, you take the samples and send to a higher laboratory. So in Abuja, we have National Research Laboratory that can test virtually many things. You have another one in Lagos. You have quite a few, again, private sector, Jide in Osun. We have in Luth. Those ones can test for pathogens of high consequences because they are built for it. They have all the equipment for it. Now we have now regional labs who can detect but may not be able to characterize. You understand? Because they require different expertise. And that's again, you need human resources, trained in different capabilities, apart from the facilities you need. Right. The other one is that in preparing, you can imagine, okay, what do we have? This thing is coming now. What do we expect? You understand? So prepare in terms of infrastructure. So for COVID, we built in those isolation centers, treatment centers. Isolation centers because it's very highly contagious. What we've done in this country is that the isolation centers are built in different states. You understand me?
But is there a need to update those isolation centers?
Oh, definitely. We're constantly doing that. Take, for instance, for Lassa fever. What kills in Lassa fever is the kidney shutdown. The people go into renal failure. If they are not properly treated, that's when they die. What we've done from NCD is we procured dialysis machines to key facilities, teaching hospitals that have the expertise to treat those complications. So that when they detect those cases there, they can easily transfer them to where they can easily treat them and prevent. And that's the other is to reduce mortality. Apart from these cases.
Just before I let you go, DG, we have 1 more minute if you can do this. Specifically, speak to the issue of precautions. What should people do, or what precautions should people be taking right now? The Yuletide is here. People will be traveling. And you have assured us that, okay, Nigeria, of course, is on top of the matter and trying to address the issue. But speak to us in terms of precautions, individual. What should they do?
Individual precautions. You see, most of these you can just basic public health precautions. Hand washing. If you remember, hand washing, soap and water. Or if you don't have soap and water, use your sanitizers, hand sanitizers. Personal hygiene. When you are coughing or sneezing, because this is how these things present. Coughing, you sneeze in such a way that you don't spread disease. Face masks, especially when in a crowded place. Avoid crowd. When you're in a crowded place, use face masks. You understand me? If you get that, then the other one is for public health workers. When they are in contact with all these diseases, they need to protect themselves before they can protect. They need to wear PPEs. That's how we expect to wear gloves, face masks, so that they don't spread. They see these patients, if they're not prepared for hand washing, they start spreading from one patient to the other. So what they call an infection prevention and control in those facilities, hand washing, PPEs for health workers. For the people, basic hand washing, personal hygiene, respiratory hygiene.
All right.
They are basic things. Avoid overcrowding. And when you know that, the symptoms, fever, the same thing as fever, but when you start having loss of taste, loss of smell.
So this is the same as COVID-19?
They present the same way.
The same symptoms as COVID-19?
It's just that there are people who are more susceptible. Older people, people who are immunocompromised, children, people who are 60. And that's why the death rate increases.
All right. So just to be clear, you said XEC. Is it XEC or XEC?
XEC.
Okay.
It's not
XEC
in this
variant.
country right now.
It's all right. Thank you so much.
We are on the lookout.
Dr. Jide is the Director General, Nigeria Center for Disease Control and Prevention. Thank you for your time on Newsnight.
You're welcome.